Ozempic and mounjaro are FDA approved to treat type 2 diabetes and belong to the GLP-1 class of drugs. How do Ozempic and mounjaro help manage diabetes? Ozempic and mounjaro manage type 2 diabetes by helping the body make more insulin in response to food, preventing the liver from making glucose and delaying gastric emptying. These actions reduce the appetite, reduce food intake and result in lower blood glucose. Can you take both at the same time? You should not take Ozempic and mounjaro at the same time. However, you can switch from one drug to the other because they both treat type 2 diabetes and work similarly. Keep in mind that switching between drugs could result in more side effects as your body must adjust to the new medication. Differences between Ozempic and mounjaro. Ozempic and mounjaro are both GLP-1 drugs, but they have different active ingredients, doses, mechanisms of action and U.S. Food and Drug Administration approved indications. The FDA approved mounjaro and Ozempic to treat type 2 diabetes, but Ozempic is also approved to reduce the risk of major cardiovascular events in people with type 2 diabetes and established cardiovascular disease. Ozempic is made with semaglutide and is available in 0.25 mg, 0.5 mg, 1 mg and 2 mg doses. Mounjaro's active ingredient is tirzepatide and it is available in 2.5 mg, 5 mg, 7.5 mg, 10 mg, 12.5 mg or 15 mg doses. Mounjaro delivers these doses in a single-use pen injector. While Ozempic also uses pen injectors, each pen may contain more than one dose per pen. Which is more effective, Ozempic or mounjaro? Everyone reacts to medications differently, but studies have shown mounjaro is more effective than Ozempic for controlling blood sugar. In the SURPASS-2 clinical trial, mounjaro reduced A1C levels more than Ozempic. Ozempic versus mounjaro for weight loss. Mounjaro is more effective than Ozempic for weight loss, though it's important to note that neither drug is approved for weight loss. Participants in mounjaro clinical trials lost 12 to 25 pounds, according to Eli Lilly's clinical trials. How do side effects differ between Ozempic and mounjaro? Overall, side effects of Ozempic and mounjaro are similar, though mounjaro may have more side effects and more severe side effects. Mounjaro's prescribing information warns of severe gastrointestinal disease in its warnings and precautions, while Ozempic's does not. Recent safety concerns. Recent safety concerns for both drugs surfaced after patients started reporting serious gastrointestinal problems such as gastroparesis, also known as a paralyzed stomach, that could lead to hospitalization. Mounjaro's warnings and precautions mention severe gastrointestinal side effects. In contrast, Ozempic's prescribing label doesn't mention gastroparesis or severe gastrointestinal side effects. The label only cautions that people who report gastrointestinal side effects should be monitored for acute kidney injury. Cost differences between Ozempic and mounjaro. The cost difference between Ozempic and mounjaro isn't much, though mounjaro is more expensive than Ozempic. On average, Ozempic costs about $1,000 a month in the U.S. Mounjaro's list price is $1,023.04 per fill, according to Eli Lilly. Some reports say the drug can cost as much as $1,300. Currently, most insurance companies do not cover the cost of mounjaro or Ozempic for weight loss because these drugs are not FDA approved to treat obesity. Should I take Ozempic or mounjaro? Mounjaro is more effective for weight loss and lowering A1C, but it could also come with a greater risk of side effects, particularly severe gastrointestinal side effects.